Okay, we're going to go over suctioning and trach care of a patient. This is a sterile procedure, so we need to make sure that our hair is back, our sleeves are up or off, so that we don't end up breaking sterility in any way. So first, we're just going to knock on the door, hand hygiene, provide for privacy. Hi, Mr. Smith. My name's Tira. I'm your nurse. Your CNA let me know that you felt like you were having some secretions. You were having difficulty breathing. Is that correct?
It is.
Okay, so first I'm just gonna verify your name and your date of birth, so let me know.
Steven Smith, birthday XXX, XXX.
Okay, that matches. Do you have any allergies? All right, so I'm gonna take a listen to you to just verify that we do need suction. Is that okay?
Yes.
I'm gonna put this pulse ox on you, and we'll kind of leave that on the entire time. That way I can monitor your oxygen saturations. We're gonna listen to 6 sites on the front. And then we'd also listen to 8 sites on the back. It does sound like you have some secretions built up, so we are gonna suction you. I'm just gonna start by putting on this trach mask to do some hyperoxygenation. Just gonna lay this on here. Put on some gloves. Gonna set up suction. We're gonna take the small tube and hook it from the suction apparatus to the bottom of the suction canister. And then the longer tube goes from the patient hole to the actual patient. And we can turn on our suction. We're gonna wipe down our table and inspect our kit to make sure that it is good and intact. And now we're ready to be sterile. So we're gonna open our kit away from us. The first thing in our kit is gonna be our sterile gloves, so we can set those to the side. Then we have paper draped in here. Shiny side goes down. This is just to protect the patient and their clothing from any secretions that may drip down. And then we're going to put our sterile gloves on before we touch anything else. I'm going to raise this just so it's at a better working height. Make sure we respect our 1-inch border of our glove paper. Get it nice and open so it doesn't close back in on itself. And now we can use our glove paper as an extension of our sterile field. So we're going to take our suction catheter out. We also want to go ahead and take our sterile water out and get that ready. We can go ahead and take out our trach care contents as well. We have a split gauze. We have regular gauze. And then we also have our cleaning brushes and our trach collar. This doesn't need to be sterile, so we can kind of set it off to the side. And then we're going to get ready to suction our patient first. We're going to roll our suction catheter into our dominant hand first, and we're going to lose our non-dominant hand. When we put this together, we're going to be careful not to touch our 2 hands together and contaminate our sterile hand. We can give this a good test. So when you cover this with your thumb, it activates the suction. It is suctioning. So we're ready to suction our patient. Again, this hand is now dirty, so we can use it to take away our patient's oxygen mask, tell our patient brace themselves, and then being very careful not to touch the outside, we're going to go in, until we meet resistance or the patient coughs. We're going to go back 1 to 2 centimeters, activate our suction, and then suction on the way out. We don't want to do more than 10 to 15 seconds. We're going to re-hyperoxygenate our patient. We want to give them 60 seconds in between passes and then no more than 3 passes. Now, we are going to try to keep this hand sterile because we're going to switch to cleaning out our inner cannula, and that part has to be sterile. So for now, we're just going to kind of drop this onto that field. This hand is still sterile. We want to remove with our dirty hand our trach mask, and then also with our dirty hand, unlock and remove the inner cannula. This hand's sterile so that we can clean the inner cannula. So we're going to dunk in, scrub our cannula. Some of these do like to spin, so be very careful. All right, it's scrubbed. Now we're going to put it back into the patient, being very careful not to let it touch outside anywhere. And lock it back in place. Sterility's over, so now we are able to finish trach care. We're going to remove our split gauze. Use our Q-tips to clean the trach plate and the stoma, assessing our stoma, skin, making sure there's no irritation, redness, or secretions. We're going to clean the plate. Then we can kind of pat it all dry. Attach our new split gauze. And then it's important when we switch to changing the trach ties that we do one side at a time. We don't want the trach to become dislodged from the patient. So we can do this one of 2 ways. We can ask a buddy to come in and kind of hold the trach in place, which I will do for this purposes. But if your patient's alert and oriented, they're also able to put their hand up here and hold this for you too. We're going to take our new trach tie and drop it behind the patient's head just so it's in place for us. We're going to take off one side first and attach the new one. And then we're going to remove the other side. Sorry, Mr. Smith, I'm all up in your face here. And then attach the other side. Then we're going to document all of the things we did. So we're going to document suction, the size of the catheter that we used for suction, how the secretions look that we got from the patient, how many attempts we did, and how the patient tolerated it. We're also going to document all of our trach care and that we cleaned our inner cannula. Some inner cannulas now, though, are disposable, so you would just have to take the old out, throw it away, and get a new one, keeping the end that's going to go into the patient's airway sterile. And that's it for trach care and suctioning.